Hi, I'm Felicia, and I'm in the process of posting videos about some of the failings I've experienced within the NHS over the last 12 years regarding my care, in the hope of getting urgent intervention and accountability for what has happened to me and to prevent failings happening to others. This video is about Leeds Teaching Hospital. In 2014, I was admitted to Leeds Teaching Hospital for a condition that severely affects my eye and causes ocular pain. And what happened following this admission has seriously impacted my care over the last 12 years. My condition in brief involves left-sided facial, periocular, ear and head pain. But to begin with, the main cause of concern was ocular pain, as it was triggered by a flea bite to my left eyelid, which caused orbital cellulitis. In 2014, a professor of ophthalmology at Leeds Teaching Hospital found and diagnosed infection. His clinic letter clearly states that infection is the likely cause of my condition. He admitted me for 48 hours of IV antibiotics, and at the end of those 48 hours, he discharged me without doing a blood test first to see if my condition had improved and the infection had improved. And he also wrote to my GP at the time to tell them to prescribe no more antibiotics. Following this, my condition severely worsened. I became extremely ill with malaise, fever, chills, stiff neck, nausea, and really, really severe pain. But because my medication had been stopped by my GP, I was forced to seek help privately, and this cost me £18,000 of borrowed money for this care. Because this ophthalmologist is a leading light in the UK, particularly for ocular plastics, his decisions have had a really significant impact on the way I've been viewed and treated by future ophthalmologists. I've seen over 5 different ophthalmologists at different clinics, at different NHS trusts over the last 12 years. And they've either discharged me after 1 appointment or 2 appointments most. And it's pretty likely that their actions have been influenced by the fact that I was written off by this professor. So his actions have really significantly impacted my medical journey and the care, the lack of care that I've received over the last 12 years. In 2022, my GP referred me to oral maxillofacial surgery at Leeds Teaching Hospital by instruction from York Hospital about the pain in my remaining parotid gland. Oral maxillofacial surgery refused to see me and discharged me without seeing me. They didn't give me a reason why they wouldn't see me, but this not only impacted me and my care, but it also undermined my GP's professionalism and went against GMC guidelines about working with colleagues with respect and collaboratively. You know, these events at Leeds Teaching Hospital have had a real impact on how my journey has unfolded. And particularly with the ophthalmologist, if different decisions had been made back in 2014, I'm convinced I would not have experienced the 12-year diagnostic delay that I have. It really did impact how things have panned out with my medical journey. Now, whilst the PHSO didn't uphold my complaint about that particular professor or reimburse me for the £18,000 that I had to spend on antibiotics and blood tests, I still want answers and accountability about why you've made these decisions at Leeds Teaching Hospital. Why did you stop my antibiotics without doing a blood test first? Why didn't you refer me on to a different department, infectious diseases, any other department? And why did you refuse to see me without giving me a reason, just shutting my file down? So I really would like to know, from Leeds Teaching Hospital about why you made these decisions, because they are still impacting my journey. I'm still being dismissed by ophthalmologists because of this. Accountability and answers are so central for a patient's healing when harm in healthcare has happened. It's very confusing when trusts and departments act with such severity and lack of candour. It leaves the patient confused and at a loss to know why this happened. And the first stage of healing for any incident where harm has been caused for any patient starts with transparency and accountability. Why? Why refuse to see a patient and why stop their medication when you knew they had an infection? So I'm asking Leeds Teaching Hospital to please come forward and explain these decisions you made, and perhaps acknowledge, what the impact they've had on and continue to have on my medical journey. Transparency and accountability in healthcare are where safe healthcare starts. Without these, we don't have patient safety and healthcare. And all I'm simply doing is asking you, please, for answers and accountability. Thank you.